Hi, welcome back to Antai Hospital's YouTube channel. And in today's video, we'd like to discuss the topic which is PCOS causes ovulation obstruction. Now, what does that mean? So PCOS causes ovulation obstruction means that it's causing menstrual irregularities. What that means is that you're not regularly menstruating. There's something that's obstructing ovulation, and ovulation means release of egg cells for fertilization or for your menstruation. So that means these women, they are not doing that regularly, which means their endometrial lining is not shedding regularly. It's thickening over time, but it's not shedding, which can lead to some unwanted complications. And furthermore, they will be constantly experiencing infertility. And even if they do manage to release an egg cell, this egg cell is of lower quality, it's prone to more defects, and it can cause embryo implantation failure, and it can lead to miscarriage during the pregnancy as well. So at the end of the day, they're still struggling to start a family. They're struggling to solve this condition. And how it causes this ovulation obstruction is due to these chronic hormonal imbalances. These women have high levels of testosterone, and it also can lead to high levels of estrogen as well. And it causes the walls, the ovarian exterior of the ovaries to be slightly harder and thicker, causing difficulty for the egg cells that have matured inside to penetrate directly into the wall to be released. That's why these women are having such difficulty in having ovulation. Furthermore, if they do go for IVF, many patients are still going to this mistake where they are going for IVF. They can solve the ovulation obstruction problem by directly removing these egg cells from the ovaries. These egg cells are already prone to be lower quality because of these hormonal imbalances, these chronic hormonal imbalances. It can lead to pregnancy problems as well. And even if you do manage to sustain that pregnancy, which is very unlikely, this child will be having some form of defect, whether it's physically or intellectually. And as parents, ideally we want to have physically and intellectually, mentally healthy and capable children. That is our responsibility. And here at Antai Hospital, we can have this condition treated. First of all, identify whether or not you have irregular menstruation, where it's much more longer than 28 days, could be 35, 40 or 50 days, and you menstruate very infrequently, just a few times a year. Secondly, observe, do you have any physical symptoms of PCOS? A lot of acne, a lot of body hair, insulin resistance or obesity, inability to lose that weight. You also have mood swings, and also you have a tendency to be much more aggressive, and you have rough patchy skin as well. These are only some of the symptoms. That is a total of 21 clinical symptoms that we can observe. Thirdly, are you experiencing infertility or recurrent miscarriage that's happening over and over again? You're struggling to get a healthy pregnancy, but that is just not happening. If you answer all three for these, then you may stand a chance to have PCOS. So you need to quickly go to your nearest medical institution and get yourself diagnosed, and it can be done very quickly. Just a simple ultrasound and a blood test, and we can tell whether or not you have PCOS. Treatment here at the hospital, as we already discussed, that we will be using 3D laparoscopic technique to actually remove these abnormal testicular cells, these defected ovarian cells that are present within these ovaries. That is the root cause of PCOS. We have those removed, and you can see your symptoms quickly subside within a week or two, and pregnancy can be achieved. This treatment comes with a full refund guarantee here at the hospital. If you still struggle with pregnancy after our treatment, or if you're still miscarrying, then we will refund you full treatment costs. At Antai Hospital, we take all our patients' needs very seriously, and PCOS is in fact a treatable condition. So don't be worried. Quickly get in touch with us if you are interested. Chat with our consultants, send us an email, and let's see how we can help you today. Leave me some feedback down below, and stay tuned to the next one.